morning we're here with Lord Nigel Crisp. Welcome, Nigel.
Thank you.
I just come from your talk that you just did this morning. It was on health leadership in the digital age, right? Yeah. And there was an interesting quote that you mentioned at the start from Martha Lane Fox.
Yeah.
And let me get this right. It was, the internet is the organising principle of time.
It's the organising principle of our age.
Yeah.
So in other words, everything you do, whether it's shopping, whether it's your social life, whether it's your leisure, whether you're trying to find out where to go in Auckland when you arrive here as a visitor, then you use the internet in ways that 10 years ago you did things very differently. So that's the organising principle of our age. So shouldn't it be the organising principle of health and healthcare as well? And shouldn't we make more use of it? And that's why this conference is so important.
Okay, yeah, that's good. That's a good quote. And tell me about how you integrated that with your talk today.
Well, I used a number of different examples of how the internet changes everything. It changes the relationships between people. I gave an example which I think is a fantastic example from Holland. I think there are others, of something called ParkinsonNet.org, which is actually a grouping of 2,700 health workers in Holland, organised into regional groups. But it's a internet-based service whereby patients are part of this whole network. They can access all the protocols, they can look at the research, they can choose which clinicians to go to, they can link in just equal partners, if you like, with their clinicians. And it's a completely different way of organising how we might have looked after people with Parkinson's disease before. Because ordinarily you might have looked after them in your GP and they might have sent you to specialists and so on, and you'd have been sort of fitting in where they wanted you to fit in. Whereas this, you're an equal partner. It's changed the whole deal.
This kind of creates the patient being the centre of care in a way, isn't it?
It does. It does indeed. But it also creates, and interestingly, they're trying to find another word for patient, because they don't want the patient to be a patient.
I remember you saying that, and I'll sit there going, what could it be?
The person who used to be patient. Is the line that the Dutch guy, a man called Bas Bloem, uses for it. So it's the highest technical research, but also it's the most low-tech in a way, because it's just the internet. It's nothing deeply fancy. But people are working together on dealing with, helping people to live with what is a very disabling condition.
So this is a really great initiative that they've got going. You've got the patient involved, the clinician involved, all the recent research, and sort of creates a group of autonomy, really, isn't it, to try and look up what they want and which way. Because as you were saying, that a disease process is a disease process, but it does manifest differently in people, and so those people may want different things that come from it. So this is a good initiative to have. It'd be nice to see it across all other chronic kind of diseases, isn't it?
I think so. I mean, it's interesting when they do surveys of Parkinson's patients. I mean, Parkinson's may affect how you walk, how you eat, whether you dribble, whether you sleep well, whether you have a sex life, all these kind of things. And different things will be important to different people with Parkinson's, and therefore their clinicians need to be orientating the treatment to try and get the maximum benefit that is the one they want, as opposed to the one that some other patient might want. So it is absolutely patient-centred, and I think you can be thinking about it in other conditions as well. And it's not the old model of GPs and hospitals. It's sort of in between.
And so that's a sort of like a data kind of example. You had another example later on about a community where they. You can tell me a bit more about that one.
So the other example is really something that I think is coming. We are pivoting, if you like, from healthcare to health, and thinking about health, and thinking about, I quoted a great African saying, which is, health is made at home, hospitals are for repairs. So actually, how do we make the home as good at creating health as it can be? And this is a poor area of East London, where the schools, the GP surgeries, the churches, the voluntary organisations, the pharmacists, the businesses are all working together to create a much better place to live, and as a result, somewhere that is actually helping people to be healthy. And digitisation is important in that, because people are able to share records. One of our difficulties in the UK, and I'm sure it must be true in New Zealand, is that local government will keep records separately from central government, from voluntary organisations. Can't we bring this together so we're really focusing on the same issues?
We do have that issue in New Zealand, especially
sure.
Private, public sort of GP
and private
practices.
public as well. And these partnerships are everybody. They're not just the sort of traditional people.
Yeah. So your main points would be to create connectivity, using technology to try and create that connectivity as well. Yeah.
It would be, but I think it's also slightly wider than that, which is that we tend to think of health as something that health professionals do. Actually, in future, we've got to think of challenge employers about their responsibilities, because some employers, do damage health, if you like, employment does. And we've got some good examples in the UK of leading employers who are trying to work on creating a healthy workforce, because after all, that's good for productivity anyway. So there's a business plan approach to it as well. So I think, so the thing's changing. We need employers as health leaders, we need educators as health leaders, and not just doctors and nurses and all these wonderful people.
Yeah. And one of the other interesting points you brought up was how this is all going to change leadership. And particularly with ownership of data and those sort of challenges. You talked about how we're going to have leaders who sort of focus on that area. And where do you think that's all going to kind of heading?
Well, I think the rules are changing, if you like, how people relate and so on. And I think all of us have concerns about people collecting our data. What are they going to use it for? Are they going to get access to our phones? Are they going to, are we going to spend all our time with junk mail? But more seriously than that, are people going to be able to use our personal information for different reasons?
Yeah, like profiling and things.
Profiling, exactly, and sometimes for stealing identity, whatever. There's a whole range of stuff, and we need some. What I and others are arguing, and I agree with them, is that we need some kind of charter for how you make sense of the digital age. What are the rules? How should we be protecting privacy? How should we be making sure that the benefits of all this digitization reach the poorest people in society, who are the least healthy, as well as those of us affluent middle classes who can work all this stuff. So there's some really big, difficult questions, and we can get enthusiastic about the technology and where it can take us, but we'd better just remember that. And this conference is full of people who are leaders in this field, and I think they've all got a responsibility to be thinking about how we create that charter. And I think you should set up a group here in New Zealand to work on that charter and to work with your friends in England and Canada and elsewhere.
So creating like an ethical charter. That would be,
absolutely.
A good idea. And the last part of your talk, you sort of started it off talking about the internet and how it's changing people, and then you sort of ventured into talking about connectivity and patient relationships and things. And I guess the main question I had for you is, how are we going to sort of bind those two together? How do we create connectivity behind someone who's sitting behind a computer?
I think there's a danger here that we can get sort of seduced into thinking that it's all about technology, whereas change happens people to people. I quoted Samuel Gray, the wonderful quotation of his, which is that health is a human contact sport. Actually, if you're my clinician, I want to know what you think. I mean, yes, you've got all this data and all the rest of it, but actually, what do you think? And when I'm seriously ill, I quite like somebody to hold my hand rather than just look at a screen. You know what I mean? And actually, change happens because of relationships. And if we think of these big organisations who are trying to make work together, health and social care and education and others that are important for childhood development, well, actually, if I'm running a bit of that, I need to have some kind of relationship with the people in those other sectors. It's not that our systems need to work together, because they won't work together unless we work together. So it's the two things together. I mean, the internet and IT and digitalisation can help enormously, but at the end, it's about human beings.
It's always about that one-on-one interaction in the end, isn't it? The face-to-face sort of part of it.
It is indeed. It is. It is. That's why we're human beings, and why there's a great sadness in loneliness, as I mentioned in the talk, and how bad that is for our health. So actually, it's the relationship and culture always trump strategy and systems, but good strategy and good systems are important. But actually, relationships are what will change the world.
Exactly, yeah. And I just want to re-quote what you said in the talk, that loneliness is equivalent to 15 cigarettes a day. Is it in health risk? Yeah. Interesting. Yeah.
So quite substantial.
Yeah. Cool. All right. Well, Lord Crisp, thank you for coming along today, and I hope you enjoy the rest of the conference. And thanks for coming and having a chat with us today and updating us on your talk. It's been lovely.
Thank you very much,
Thank
Carrie.
you.
Thank you.